Hi guys, welcome back to our channel. I'm Dr. Jusha Bhatia Sarin, and today we are going to dive into Profhilo, the buzzy skincare treatment that everyone's talking about. It's a game changer for glowy, firm skin without the drama of multiple sessions, long wait periods, or anything of that sort. But what exactly is Profhilo? Now picture this. Profhilo isn't your typical filler that adds volume to your cheek, your lips, or your chin. This is a supercharged hydration booster that spreads evenly across your face to not add up to volume, but only to give you a firmer, tighter appearance. The fresh, natural glow that you see after the procedure, because it literally wakes up your collagen and elastin. Who is the ideal candidate for Profhilo? If you are in your 30s and you're noticing a bit of sag, some fine lines, and some mere dryness happening on your skin because of sun, pollution, work-related stress, long working hours, then Profhilo is going to match your vibe. It's A's for prevention of fine lines and for a quick refresh for both girls and boys alike. But you can skip it if you're pregnant, nursing, allergic to hyaluronic acid, have keloidal tendencies, or got a lot of active acne on your skin. Now, what's exactly inside the syringe of a Profhilo? Honestly, it's pure magic. 64 milligrams of hyaluronic acid, the highest dose that ever exists in a syringe. Now, the word high-low in Profhilo really means high and low molecular weight hyaluronic acid. Now, this low molecular weight hyaluronic acid is what gives you hydration, and the high molecular weight hyaluronic acid is what gives your skin structure. There are no funky chemicals in this, and it is thermally stabilized for safety. But what was really the need of creating a Profhilo? The story is very interesting. Just back in 2015, a Swiss company called IBSA saw the need of having hyaluronic acid in your skin. That's because your natural hyaluronic acid really tanks after 30, and that gives your skin this saggy, dull appearance, and you suddenly feel that you look a bit tired when you're not. Pollution, stress, sun, all of that, yes, these add up to the situation. So Profhilo fills that gap. It's better than a cream, but it's less intense than a surgery. So why do we really need hyaluronic acid to be injected into our skin? Your skin naturally makes hyaluronic acid to stay plump and bouncy like when you were a baby, but age zaps it up. Now Profhilo not only injects a hybrid version of hyaluronic acid to keep your skin from looking dull and tired, because it gives your skin hyaluronic acid it needs to stay plump and bouncy, but over a period of time, it also remodels your collagen and elastin, so the skin structure becomes more firm and turgid. Now, Profhilo has become a huge worldwide buzz, and rightly so. Since launching, it's exploded the skincare market. It's approved in 70 plus countries, and millions of treatments have been already performed. In the UK, it's the top skin booster. Asia and Middle East, celebs swear by it for the glow it gives. Here in India, it's slowly but surely catching up. But since it is hyaluronic acid, a lot of people question what is the difference between a Profhilo and a filler. So here's a quick breakdown. So first, let's talk about the structure. As for Profhilo, it's a flowy hybrid hyaluronic acid. As for fillers, it is a thick, cross-linked, gel-like blob. The job of Profhilo is to rebuild and hydrate the skin. The job of a filler is to give volume or structure to a deficient part of your face. By the look of it, Profhilo builds glow on your skin in the next 4 weeks, whereas a filler corrects your volume deficit instantly. Let's talk about the lifetime. Profhilo will last for about 6 to 9 months, whereas a filler can last up to 6 to 18 months. They are also performed differently. Profhilo is given only on 10 specific points on your face and 10 specific points on your neck, whereas a filler is injected when and where required. So let's talk about how Profhilo is injected into the skin, and it's super chill. Your dermatologist will apply a numbing cream for 30 to 40 minutes, and then the doctor uses a technique called BAP technique, which is 5 specific injection points put on your face. This ensures even spreading of Profhilo underneath your skin surface to give you that unmissed glow. The doctor can inject it with a needle or with a cannula depending on their and your comfort. You will see a mild bump on your skin at the site of Profhilo injection because Profhilo is injected really very superficially. A gap needs to be created for it to settle well in your skin. This swelling will die down in next 1 to 2 hours. Profhilo is a self-spreading hyaluronic acid and it flows like butter. And if you have decided to undergo a Profhilo treatment, here are a few things that you need to keep in mind before taking the session. A week before the treatment, you need to avoid green tea, fish oil capsules, vitamin E capsules, or any blood thinners that you might be on. If you are on a blood thinner, then do ask your physician and your dermatologist about alteration of doses if required. Skip fillers and lasers 2 to 4 weeks before the Profhilo treatment. And on the day of Profhilo, drink a lot of water. The more water you have in your body, the better the results, because hyaluronic acid is going to really capture all that water. And a couple of aftercare basics that you need to know about. Most patients have zero downtime. Some patients might have a bruise. You can really do makeup and go to work the next morning. But for next 48 hours, we want you to preserve your water, which means less sweating. So avoid the sun, avoid the gym session, avoid saunas at all costs, and drink a lot of water. If you see any bumps, pinkness, redness, it'll go maximum in a day. So when do you see the results? If your skin is well hydrated, even the next morning you might see some glow on your skin. If your skin is dehydrated, it might take a couple of days for the glow to start building up, but ideally it comes in 10 to 15 days. But the real firmness it is going to give you requires collagen and elastin remodeling, which will take about 4 to 6 weeks. If you are able to take 2 sessions 1 month apart, this is gold. They will last you about 6 to 9 months, and you need a yearly top up to keep that glow intact. Now, how is it working on Indian skin? Our Fitzpatrick skin type is 3 to 5. We face humidity, we face dullness, we face a lot of sun because of the tropical country we live in, and we face pigmentation risks. So if you're looking for a refreshed look with deep hydration, this is the one to try. What are the possible side effects? The scariest thing that could happen is actually a bruise, which will last you 3 to 4 days. If you see anything unusual happening on the skin, of course contact your dermatologist or your caregiver. That is all from my side and Profhilo decoded for you guys. If you have any more questions related to Profhilo, please ask them in the comment section. And if there's any other skincare therapy that you are interested in and you want me to elaborate upon, please let me know in the comment section. If you are enjoying skin and hair care secrets, recommendations and therapies, then do click on the subscribe button on our channel and don't forget to like this video. I'll meet you guys in the next video with another skin or hair care topic. Up until that, I wish you all a very happy and healthy skin.